It's been nearly a month since Ontario went into lockdown. Well, over the past few days, we have seen a decline in COVID-19 case numbers, which experts say is a positive sign that the lockdown is working. Well, earlier this week, Ontario's chief medical officer of health had said easing restrictions would require Ontario to see less than 1,000 cases a day. But one expert say that number should be much lower than that. It's a glimmer of hope. The 7-day rolling average of COVID-19 cases declining for the 10th straight day.
Even progress in the numbers that we're seeing. It's telling us that the lockdowns or the measures that we put in place are actually paying dividends now. That doesn't mean that we get to relax. It just means that, there is hope on the horizon.
But just what will it take to ease restrictions?
Places where they've really had really good control of COVID, they've brought it down to only 1 in a million per day. And so that would be, in a population of Ontario, that would be a 15 per day, which sounds, unbelievably low. But back in the summer, we were down to about 30 or 40 a day.
Experts say while the case numbers are declining, hospitalizations and deaths due to COVID-19 remain steady, continuing to put a strain on the healthcare system. Experts say the province needs to keep an eye on those numbers before considering easing any restrictions.
A good way to say that, we might see a relax of the lockdown measures is when we start knowing that our hospitals can accommodate people when they walk into emergency rooms and that our ICU units are not at full capacity. I think it's going to take some time to get there, but so far the decline in the numbers is heading towards the right direction.
So I think we need to be, as aggressive as possible to bring the number down as low as possible, and then be very careful about which restrictions we relax first, and relax them slowly. If you relax them all at one time, then we're going to be back to where we were before.
Infectious disease experts say what is concerning right now is the new variant, which they say the province should be keeping an eye on. The good news, though, to stop the spread of that, all we need to do, they say, is to continue following public health guidelines. Nakhavoly, City News.